Good afternoon. Today I am discussing about ascites. So, what is ascites? So, it is the increase in abdominal fluid, increase in abdominal fluid, or we can say that abdominal effusions. So, if we talk about ascites is due to some other secondary disease. So, it is a secondary problem due to some other primary underlying disease, right? So it is a secondary problem. So ascites is sometimes life-threatening also. Why life-threatening? Because when there is fluid accumulation in the abdominal cavity, that will put up a pressure on chest cavity. So it will put up a pressure on chest cavity and lungs will not expand or inflated. Will not expand or inflated, so that will lead to problem with the respiration. That's why it may be a life threatening condition. So various symptoms of ascites are there, like lethargy, right, inactive हो जाता है dog, right, vomiting, diarrhea, decreased appetite, pain on palpation of abdomen, right, and rapid and shallow breathing. uh, you may observe difficulty in respiration, dyspnea, ठीक है, and other problems we observe in ascites are coughing, right. uh, Next, what are the causes of ascites? There are various causes of ascites are there. Like first, uh, ascites is observed in heart disease. Heart disease. Heart disease. Heart disease include DCM, dilated cardiomyopathy, pulmonic stenosis, stenosis of pulmonary valve, pulmonary artery valve, right, pulmonic valve, pulmonic stenosis, or narrowing of pulmonic valve, right. So it will put up pressure on right-sided heart. So right sided heart disease may be responsible for ascites, and right-sided congestive heart failure, it will also leads to ascites. Heartworm, this parasite is present mainly in the pulmonary artery, so it will cause right-sided heart failure and ascites. So heartworm. Second cause that is responsible for ascites is liver disease. Liver disease include hepatitis, portal hypertension, and chronic liver disease. So this will lead to ascites. Next cause of ascites is low protein level. So proteins, they are responsible for osmotic pressure. So there are two types of pressure in the blood vessel: hydrostatic pressure, which will be in this direction against the wall. So, and osmotic pressure is away from the wall. So this osmotic pressure is due to plasma proteins. So if there is less plasma protein or low plasma protein, this pressure decreases and fluid will leak out due to increased hydrostatic pressure, right. So low protein level may be due to various reasons. What are those? Either production of plasma protein occurs in the liver. So if there is liver disease, so there will be decreased production of plasma proteins and there is decreased osmotic pressure, and there will be ascites and effusions in various body cavities. Other reason for low protein could be malnutrition. If protein level in the diet is not appropriate, so that will lead to low protein levels, and this will lead to uh, ascites. So another could be protein losing nephropathy. That includes kidney disease, nephrotic syndrome. If there is loss of proteins from the kidneys, so this will lead to low protein levels and low osmotic pressure, and this will lead to ascites. Another reason would be protein losing enteropathy. If there is malabsorption of protein, right, or there is loss of protein from the GIT, so this will lead to low protein level, and this will lead to low osmotic pressure, and this will lead to ascites. Another reason of ascites would be peritonitis. If there is infection of the peritoneum is a layer that lines the abdominal cavity. So if there is infection of that layer, this will lead to fluid accumulation, and there is ascites. Another reason would be cancer. So any various type of neoplastic diseases, they will produce ascites. And a very important reason of ascites could be trauma. So various organs, they are present in the abdominal cavity. If they get traumatized due to any reason, they will their fluid will leak into the abdominal cavity, and this will produce ascites. So depending on which organ is gets traumatized, various types of fluids you observe. Like if there is a trauma to the urinary bladder or ureter or pelvis of the kidney, so this will lead to leakage of urine in the abdominal cavity, and this condition leads to uroabdomen. So if there is a trauma to the spleen, liver, any other organ, right, this will lead to blood accumulation in the abdominal cavity, and this condition is hemoabdomen. So if there is a trauma to the GIT, you would see the gut contents leaked. If I talk about diagnosis of ascites, so how you diagnose ascites? I told you it's a secondary condition due to some other primary condition. So how you diagnose ascites? Based on palpation of abdomen, and you do ultrasonography of abdomen. You see the anechoic or echogenic fluid. If there is blood, you see the echogenic fluid in the ultrasonography in the abdomen, and you can see anechoic or echogenic fluid, right? And you see the free floating organs. All the organs, they float in the fluid. So another test you can use to diagnose ascites is radiograph. You see the poor serosal detail on radiograph. You can't see any organ in the abdominal cavity because fluid and soft tissue has same opacity on radiograph. So if all the abdominal cavity is accumulated by fluid, you can't differentiate fluid with the other organs. So because they have similar opacity, that's why on radiograph of ascites you see poor serosal detail. That means you can't appreciate any organ. Another you go for the baseline blood work that includes CBC, biochemistry. You know that various liver function test, kidney function test we do, right? वेरियस जो भी होते हैं बायोकेमिस्ट्री में बेसिक, वो हमें कराने चाहिए. एंड यूरिन एनालिसिस and you, very important point, you evaluate ascitic fluid. This is very important. You have to evaluate this ascitic fluid. You go for the cytology, right? You go for the total protein estimation and cell counting. When you stain this slide of this fluid with any stainless man or anything, you have to see under the microscope. If I talk about treatment part is you have first step you have to remove the fluid, and then you have to address the main cause which will cause ascites. So treatment, you have to remove the fluid or drain the fluid. You can use diuretics. Diuretics include furosemide, spironolactone, but diuretics particularly used in heart disease. Another, if there is low protein and anemia, you can go for blood transfusion. If only low protein is there, you can go for plasma transfusion. If protein and low protein is less as well as anemia is there, you can go for blood transfusion. So this is a treatment part of ascites, and you have to obviously address the underlying medical condition. Thank you very much.